Welcome. My name is Daisha, and we're so happy you have joined Wise Woman and taken this step toward healthy lifestyle changes. As part of this no-cost program, you'll have access to resources, trainings, and community support. You've made it to the sixth and final week of the Living Well Ahead series with health lessons created by the American Heart Association. Our series wraps with an in-depth discussion on diabetes, its risk factors, and how to reduce your risk through healthy lifestyle behavior changes. As we wrap up this series, I want to encourage you to take everything you've learned, set some realistic goals, and make some healthy lifestyle changes. Remember to minimize distractions while watching the video and briefly pause the video when a question is presented to think about your answer. Our sixth and final weekly lesson is called No Diabetes by Heart. The information in this health lesson is designed to provide helpful information on what diabetes is and how to reduce your risk for developing type 2 diabetes. The No Diabetes by Heart health lesson is part of the Empowered to Serve movement, inspired and created by the American Heart Association. Today's health lesson will focus on the following three topics: what is diabetes, the link to heart disease and stroke, and how to take charge to reduce your risk. Now let's get started. This lesson has been developed by the American Heart Association and American Diabetes Association's initiative, No Diabetes by Heart. Later in this lesson, we will learn how this initiative aims to help empower people living with type 2 diabetes to lower their risk of cardiovascular disease. After this lesson, you'll have a better understanding of diabetes and how to reduce your risk. So, what is diabetes? Do you know what it is? Diabetes is a condition that causes your blood sugar levels to rise too high. High blood sugar levels can cause damage throughout your body and make you more likely to develop heart disease or stroke. So, what causes diabetes? Well, our bodies make and use a hormone called insulin to keep our blood sugar within normal range. In diabetics, the body either doesn't make or use insulin efficiently, which causes blood sugar levels to go too high. Common symptoms of diabetes include excessive thirst, extreme fatigue, and blurry vision. If you've been having these symptoms, contact your doctor to make a plan to improve your health. There are three types of diabetes: type 1, type 2, and diabetes in pregnancy, also known as gestational diabetes. 30 million Americans are currently living with diabetes, and 90 to 95% of them have type 2. For this reason, our discussion will primarily focus on type 2 diabetes. Does anyone know what puts you at risk for developing diabetes? Some people are at higher risk. Certain ethnic groups, including African Americans and Hispanics, are more likely to develop type 2 diabetes. Other risk factors for type 2 diabetes include family history, physical inactivity, age, and being overweight or obese. Some of these risk factors are controllable and others are not. You cannot change your race, age, or family history. However, you can manage your weight and physical activity. So watch what you're eating and be sure you're getting your heart rate up daily. Remember, when you have type 2 diabetes, your body cannot make enough insulin or is unable to use it properly. Insulin helps to keep your blood sugar at the proper levels, so type 2 diabetics often have blood sugar levels that are too high. People living with diabetes have a higher risk of heart disease. It is important that those who have diabetes or who are at risk for diabetes understand its link to heart disease. Heart disease is caused by damaged blood vessels. Blood vessels become damaged due to high blood pressure, plaque buildup, and swelling in the arteries. Over time, plaque buildup can clog arteries, which leads to heart attack, stroke, or even heart failure. Type 2 diabetics often have other health risk factors like high blood pressure, high cholesterol, obesity, and are physically inactive. All of these are major contributors to developing heart disease. People living with type 2 diabetes are 2 times more likely to develop and die from heart disease. If you have type 2 diabetes, it is important to learn about your higher risk and work with your healthcare provider to reduce your risk. Here are 4 questions to ask your doctor about diabetes and your heart. 1, what changes can I make to take care of my heart? 2, what can I do before my next appointment? 3, how will I know if the changes I've made are making a difference? And 4, what resources can help me learn more? People living with type 2 diabetes and those that aren't should take charge of their health by making practical and meaningful changes to reduce their risk of heart disease and stroke. One of the first things you can do is talk to your healthcare provider about ways to reduce your risk for heart disease. Also, you can make healthy lifestyle changes, which include eating a heart-healthy diet, maintaining a healthy weight, exercising regularly, and not using tobacco products. Other healthy lifestyle changes include managing your stress, monitoring your blood sugar, blood pressure, and cholesterol, and taking all your medications as prescribed. This may seem like a lot, but you don't have to do it all at once. Take it one step at a time. Work with your healthcare provider and start setting some realistic goals to take charge of and improve your health. Now, let's take a quick 5-question true and false quiz to assess your understanding of some of the information that we've covered today. Question number 1, seeing your doctor regularly can help you manage your diabetes. True. Managing diabetes can be a lot to handle, and regular doctor's appointments and monitoring can help keep you on the right course of action. Question number 2, people with diabetes are 2 times more likely to develop complications from heart disease. True. Diabetes greatly increases your risk for heart disease and stroke. Question number 3, managing your diabetes can be stressful. True. Setting realistic goals and working with your healthcare provider or health coach can assist you with keeping stress at bay. Question number 4, I can never eat anything with any sugar in it ever again. False. You do not have to give up sweets. The key is moderation and management. If you have diabetes, talk to your doctor and make a plan together. Question number 5, adding some movement to your day is a way to take care of your diabetes and your heart. True. The key is to move more, move with more intensity, and sit less. You don't have to make big life changes to see the benefits. Try building more activity into your day, one step at a time. No Diabetes by Heart provides tools and resources to assist those living with type 2 diabetes. Visit nodiabetesbyheart.org to learn more. Also, be sure to share your new knowledge with family and friends. By joining No Diabetes by Heart, you'll receive continued access to resources and information to continue improving your health. If you have any feedback on the health lesson provided by American Heart Association, email them at empoweredtoserve@heart.org. Great job completing our 6-week Living Well Ahead series. We're so proud of you. We also want to hear from you. If you found these lessons helpful, have any questions, or would like additional resources, please reach out to us by emailing wellahead@la.gov. Think back to all the information we've covered and pick a few things to work on that you can do consistently and put them into practice. Remember, small changes over time can make a big difference. We're so glad that you participated with us, and we are proud of all the healthy lifestyle changes that you have already made and will continue to make. From all of us, thank you and best of luck on your health journey. Be sure to check out these resources to support you as you move forward after this series. Visit wellaheadla.com/wisewoman for links to all available resources. Visit the Well Ahead Community Resource Guide at wellaheadla.com/CRG to search for support services near you. Join the Wise Woman Facebook group to receive tips and encouragement from others taking this journey with you. Again, thank you for joining us, and we wish you the best of luck on your health journey.